All right. Good morning and welcome to the CDLE Employer Webinar Series. I'm Paul Tauriello, Director of the Division of Workers' Compensation, and we are kicking off this morning's part of the series, Understanding COVID-19 Workers' Compensation Coverage in Colorado. We're going to wait just a few minutes while we allow folks to enter into our webinar. Please bear with us while we get a rather large audience today. I'm very happy to say we had quite a bit of interest in this morning's employers series, and we're happy to get as much information out to everybody. So just going to wait a little bit longer and get as many folks as we can in the door. And while we're waiting, I want to thank our support team here at CDLE, Tracy, Ross, Cara, Jackie, and Evan, as well as we have some support folks from some other divisions that I'll introduce a little bit later to help with some of the questions that we might have beyond the scope of workers' compensation this morning. So, and I will invite my helper, Evan. Let me know if we need to slow down or anything, but I'm going to presume that we've got everybody coming in to the room and that we're ready to move forward. All right. Great. Again, for folks who are just now getting into the room, we're going to go ahead and start. This is the CDLE, the Colorado Department of Labor and Employment Employer Webinar Series. This morning, we're going to be talking about understanding COVID-19 and workers' compensation in Colorado. We're going to talk about issues about how the pandemic has affected our state with regard to employers and issues with claims related to COVID-19 and other issues that you're facing. I want to let folks remind you that this morning's webinar is being recorded. It's going to be sent out to all of you who registered for the event today. And it will be available. If you know of others that are interested in getting it, please contact us. And we're going to have, of course, at the end, resources for a number of things that we're going to talk about this morning, and we'll make sure that you get the information that you need. I want to thank you for those of you who have already submitted questions in advance for this event. It'll help guide us to presenting some of the information this morning. And we're going to try to answer some of those questions more directly if we have time later on in this webinar. So I want to invite you to submit questions now if you would like to. The way we're doing this with this Zoom webinar, we're not using the chat feature. We're going to use just the Q&A feature. So as you have questions, please type them in. Our staff is going to collect those, and because we do have quite a few questions already in the hopper, and we don't know how many we're going to get from you today, we're going to summarize those questions into themes so that we can answer them as broadly as possible and help as many folks as possible throughout the event. So bear with us. If your question is not answered by me or someone on our team this morning, we're going to get back to you with more specific answers to your individual questions. So please don't hesitate to get those questions moving forward to us. As I mentioned, I'm going to be dealing hopefully with any questions that you have with regard to workers' compensation, but I want to let you know that we know as employers you're facing a lot of hot concerns these days. So we also have on our team Michelle and Eric from our Division of Labor Standards and Statistics to talk about particular labor laws that you may be facing, as well as Angela and Megan from our Unemployment Insurance Division, which we know is another area of great interest to most employers these days. So they are available for questions if need be, but again, our primary focus is going to be on workers' compensation, so forgive us for keeping that front and center. All right, so next, Evan, let's go ahead and advance. Again, I'm Paul Tauriello. I'm the Director of the Division of Workers' Compensation, which is part of the Department of Labor and Employment. And We are, like all of our colleagues at the Department of Labor and Employment, are being affected by the pandemic. And I'm going to try to explain a little bit more about how we fit into this overall. So going forward, this is the overview of, in general, of what we're going to discuss. We're going to, talk about current data and trends in workers' comp, compensability, and what is compensability, and what does that mean for you as an employer. We'll touch on a legislative update about what's been happening since the pandemic began and possibly what we might see in the future. And we're going to discuss some of your responsibilities as an employer in these circumstances, and hopefully give you some tips. I know you've been getting a lot of resources, but and I'm going to talk about how you can get even more help and perhaps some of these tips. But before we jump in, to these subjects, I just want to give you a little bit of background. As I said, workers' compensation is part of the Department of Labor and Employment. And like many of you, this pandemic has been a true crisis for our department, and we've been dealing with it as such. It's posed a crisis in three different ways. For the health and safety of the public and our own staff, we've had to make sure that the safety of all of our people and all of our customers is of top importance, making sure that we take care of everybody and do everything we can to make sure that we're not contributing to any of the negative factors of the pandemic and the spread. We're dealing with an unprecedented crisis on our unemployment insurance system. That has been a massive burden nationally on our systems to help maintain the integrity of our economy. As many of you know, this unemployment insurance is far more than just helping people out with some money when they are not able to work. It helps keep our economy working, which is a cornerstone of our department overall. We want to make sure that we help keep Colorado working. And the third crisis is just the overall economic near collapse that we had back in spring. I'm happy to say that with the measures that have been put in place, unemployment insurance being one of them, and pandemic assistance, we've been able to avert a full-on economic collapse in Colorado and nationally, but it continues to persist as a problem in the form of budget cuts. And in your world, of course, you're seeing threats to your very livelihood. So we are very much attuned to that. Our goal at the Division of Workers' Compensation has been to provide the highest level of sustainable operational capacity throughout these crises. We want to bring trust and value to the workers' compensation system. And just lastly, I want to let you know who we see as those who we serve. It's first off, workers and employers like yourself. We also serve closely the insurance community, the attorneys that represent the insurance community, as well as injured workers, health providers, a key cornerstone of our world, and making sure that injured workers are taken care of and return to work as quickly as possible to save employers as much money as possible. And of course, policymakers, those who actually decide what our laws are going to be and how we're going to do things. We don't create the laws, we just make sure they work as designed. So jumping into this, we'll go to the next slide, looking at current trends. And I want to go forward to a discussion about some statistics that we're seeing. So since the beginning of the pandemic, going back to about March, when we first started to see claims for COVID issues, we've had 6,341 claims as of January 16th. So to give you an idea of what that scope is, generally in a given year, the Division of Workers' Compensation will see about 30 to 35,000 claims filed with us. Now that's not all claims in Colorado. We only see claims filed with us that lead to lost time or are going to have permanent disability to the injured worker or are contested. Claims that are just medical only, if you will, where somebody just needs to go to the doctor once and can return to work, we don't see those. So they're not counted in that 35,000 total claims. So when we look at 6,000 claims in about a year's time, you can see that that's a significant chunk of claims this past year. Now, for the most part, that number has been offset by a reduction in other claims. So with the economic downturn that we've seen as part of the pandemic, we've seen a reduction in payroll across our state. Again, unfortunately, with the layoffs of folks, we've had fewer people in the workforce this past year than we normally would. We've had somewhat of a degree of reduction in construction. Interestingly, not as much as you might think for this kind of an economic downturn. So those factors have come into play to show a reduction in other parts of the workers' compensation system in terms of claims. So up until about a couple of months ago, the increase in COVID claims very closely matched the decrease in other regular claims in our system. So we had about the same number of claims. It wasn't like these were just dumped on top of a normal year. They were filling in the reduction in other claims in our system. Now that, as I said, that was just up to a couple of months ago. We're now seeing, however, the number of COVID claims are continuing to climb at a rate which is going to mean our overall volume is going to be much higher if this continues. We're seeing increases per week of about 4% of these total claims, and that's a very steep increase. It's leveled off recently, but post-Thanksgiving, it went up pretty starkly. And now that it has plateaued, that rate, I should say, is plateaued, we're hoping it's going to come down. Some folks have wondered, well, what's that all about? Does that match what we're seeing in the rest of society? Yes, it does. We did see a big upturn in transmission rates post-Thanksgiving. And thankfully, due to some aggressive measures statewide, we were able to get that under control by the end of December, the Christmas holidays. So we haven't quite seen as big of a spike post-Christmas as we did post-Thanksgiving. Other issues that are leading to this increase in workers' comp claims. Sheer awareness on the part of workers that this could be a work-related claim. Early on in the pandemic, it wasn't always understood by workers that, hey, this might be something that's compensable under workers' compensation. And we are seeing that awareness going up among workers. So going through these claims, you can see we've had 26 fatal claims filed. That's a big number for any type of injury. And what's interesting and what's going to be a common theme throughout these statistics is the number of claims on the fatal side that have actually been admitted. There's only 4 admitted claims. By admitted, that means that the employer and the insurer have said, we admit this is related to our work, and therefore we're going to pay benefits to the surviving spouse or dependent children in these fatal claims. 21 of these have been denied outright. There's only one that is still being looked at by the insurance company employer to decide what position they're going to take. So just a reminder to folks, we, the division, we don't pay for these claims. We are not your insurer. We regulate the system and we make sure it works as designed. And going down to look at the non-fatal claims, you'll see that of the rest of those 6,341 claims, we've had, let's see, 924 final admissions. And what that means is that claim was actually admitted and is closed. So it's done. It's not an ongoing claim. 863 claims currently are under what we call a general admission. And that means that the insurance company is not fighting it, but it's still an open claim, meaning there's still benefits being paid out on those claims. We have 645 pending status claims, meaning they're still under investigation and consideration by the insurer as to what they're going to do with them. Then the big number, 3,883 claims, cumulative non-fatal denials. So that's a huge number. Right now, our denial rate on COVID claims is standing at about 61%. And that's a pretty high denial rate for workers' comp claims in general. I need to point out, though, that that number of denials was much higher as recently as 3 months ago, 4 months ago. It was probably around 67% denial rate. So we're seeing that insurers and employers are showing a greater propensity to admit liability for these claims as time has gone by. Now, that hasn't changed much on the fatal side. No, those are much more expensive claims, and the stakes are much higher. And so there's apparently, perhaps understandably, a greater degree of pushback on admission for those claims. But we are watching this closely. A lot of folks, a common question is, well, what are the status of those claims? What's going to happen to them when they're denied? Are they just done? Well, no. As many of you understand, the employee, the injured worker, has rights. If it's denied, they can pursue this. They can file for a hearing before a judge and contest the denial. And where that stands right now is rather interesting. We've had quite a few cases that have come forward with what we call pre-hearing conferences to discuss evidentiary issues. But we've had very few, if any, actually go to a full-blown hearing where a judge can look at the facts in the case and decide what the merits are in the case, whether it's going to be ordered to be paid or denied. Once that happens, we'll have a clearer picture as to what factors judges are going to look at as to what should be admitted and what should be denied, which I'm going to talk about in just a moment. So it is interesting. We are seeing a lot of these cases taking a long time. The injured workers themselves and their attorneys are showing a high degree of asking for extensions of time. So they're wanting to get their cases just right, if you will. So we'll see, and hopefully have some more information in the future on that. So let's go to the next slide. I want to talk about compensability. So what do we mean by compensability here? Compensability means, is the claim, if it's compensable, is it eligible for benefits under the Workers' Compensation Act? And so that's kind of the whole heart of the matter. That's the big question is COVID-19 compensable under workers' comp? It's the question we get all the time in Colorado. Every state has its own workers' compensation system. It is not like unemployment insurance or other types of benefit systems that are under some kind of federal oversight. Every state has different parameters and expectations and benefits for their system. And so, yeah, the big question, are COVID-19 claims covered? Well, the short answer is yes, they can be. Does it say that in our statute? No, of course not. COVID-19 hasn't existed since before a year ago. But it doesn't have to be explicitly listed in our statute for it to be covered. The common flu, for instance, can be covered if it can be shown that it was contracted within the course and scope of employment. So course and scope of employment is the real key here when trying to determine whether an illness or an injury is going to be compensable under the Workers' Comp Act. Now, what do we look at? What does the system look at when determining if an illness in general is compensable? Right off the bat, our system is designed to have a presumption. The presumption is that if you have an injury or an illness, it's that it did not happen in the course and scope of your work, or that it did not happen at your work, and it's not because of your work. The burden is on the injured or ill worker to show that it indeed was. So it's a rebuttable presumption that it was not related to work. So a worker has to show that, no, this did happen. And for the most part, for most injuries in our system, it's pretty obvious. Somebody fell off a ladder, they got hurt. And even though the presumption is it didn't happen at work, everybody agrees. Oh, that's obvious. He fell, he got hurt, he broke his leg. That's going to be compensable. Don't even deny it. Denying it opens the door to arguments that we're operating in bad faith, which is a bad situation. That takes it out of workers' comp into the tort realm if an insurance company is operating in bad faith. So we want to look at the obvious facts. But when it comes to COVID and other illnesses, it's not quite so obvious. And the problem becomes showing that this was indeed contracted in the course and scope of employment. Now, going back in time to March of 2020, if you were, let's say, an EMT working in the mountains near a ski resort, and you had a patient that was having trouble breathing, and you transported that patient to the hospital, and it turned out that that patient happened to be one of the very first instances of COVID in Colorado. And the nurses and doctors at the hospital contracted COVID. You and your ambulance partner contracted COVID. And these were among the first cases that we had seen. You would have a very good argument that you got that disease in the course and scope of your work. And it would be hard to show to a judge that you got it somewhere else. So you would have a hard defense as an employer or an insurer saying, this isn't work related. Moving forward through time, and we start seeing people who are not even workers. We're seeing elderly people in assisted living centers getting COVID. And we're seeing people in households that aren't working getting COVID. It becomes a lot harder to say, I got this working in my place of employment, and I didn't get it shopping at the grocery store for myself on my own time. It becomes very difficult to show the actual line of transmission. So a judge will be left with looking at the preponderance of the evidence. Does it show that more likely than not that you got it in your place of work as opposed to somewhere else? So you can see right off the bat how difficult it can be and is for injured workers to prove these things. Now, talking to my colleagues nationwide in other states, and in talking with industry leaders in insurance about how are these things being handled nationally, and how are they being approached? Well, interestingly, a lot of insurance companies, executives and leaders have said, you know what, we see what the world is going through, and we're seeing for a lot of our workers that work in what we call essential fields, working in grocery stores and other places that have to remain open even during lockdowns, that if we see that those folks were getting COVID and it was more likely they got it at work, we're admitting for those. We're not making people prove that they got it. And being the skeptical person I was, I thought, I wonder how true that is. And I went back and looked at our data. And for those companies that were taking that position, I could see that in Colorado, they also were admitting for these claims. They were putting their money where their mouth is, so to speak. Now, looking at and analyzing which insurance companies are admitting and which are not, which self-insured employers are and which ones aren't, you can see trends. You can see their philosophies playing out on how they're approaching this. Some are admitting claims, others are admitting some and not others. And you can tell that they're taking a discriminate look at each case. Others are denying everything, and they are just locking them all out. And we don't know what the status of those claims will ultimately be once they're adjudicated. but you can see distinct differences in operational business philosophies from these entities on how they approach it. So all of you who are on this call, you are insured through one of three ways. You are either insured through a commercial insurance company, or you are self-insured with a permit through our division, or you are insured through Pinnacle Assurance, which is a commercial insurance company, but it is actually still distinguishable under the law as a different entity, still being quasi-governmental, if you will, to a certain extent. But in any event, you're going to be insured through one of those three, and depending on who you're insured with, there will be a different approach. And so as employers, you're not going to be making this decision on your own. You're going to be making it in conjunction or pretty much at the complete behest of your insurance company, who has the authority to make that decision for you. If you're self-insured, you're going to have a risk management department that's going to be looking at that. And many of you on this call, I imagine, are part of those risk management departments. So tying into this, let's go to the next slide, talking about legislative update. You know, what has happened so far in Colorado, and I want to tie into this also nationally, what's happening. So I touched on that concept of presumption and the burden of proof being on the injured worker to show that their illness was related to their work. Well, that is a common concept nationally, in that it's on the worker to show that they have gotten the injury or illness at work. So that's not an unusual thing where we are here in Colorado. But what we did see in response to COVID is a number of states reversed the presumption. They created a rebuttable presumption that if somebody in a specific field were to contract COVID, that the presumption would be that it was work-related. And it was rebuttable if the employer and the insurer could show that no, that actually happened elsewhere. And as I said before, rebutting presumptions can be rather difficult. Just as it's difficult for an injured worker or an ill worker to show I got sick while working at the grocery store, it can be just as difficult in those circumstances for an employer to show, no, you didn't get it at the store, you got it at home. And showing things to that effect. And in both cases, whether the presumption is one way or the other, we're seeing some really novel approaches to how to so-called prove these things. Insurance companies are turning to information with regard to location that is tracked on a person's phone. They're going to judges and saying, we would like to subpoena the records for all of the places where this worker was, and which, the phone companies can provide. You hit this cell tower, and this cell tower, and they can say, this person traveled a lot. They weren't just at home. They went to a lot of places. They went to this big event where there was a lot of people. And so they can show that these things happen. So that's just one tip of the iceberg that we're seeing of new ways of gleaning information to determine compensability. Well, in some of these other states, they went ahead and they passed these laws pretty quickly. And I'm talking about states that are not always typically known for being what we would say progressively labor friendly. States like South Carolina were among the first right off the bat to pass presumption that if certain workers got sick with COVID, that it was work-related. And the concept did come to Colorado, and we had introduced in our last emergency session last year before the, or additional session before it ended, the 2020 session, a bill to presume that workers getting sick in Colorado who worked for essential businesses, that they would be covered under the Workers' Comp Act and eligible for benefits. There was a lot of controversy with this. And one of the key parts of the controversy was the degree to which an employer would have to rebut the presumption. And they raised the bar in the early proposal and said it wasn't a preponderance of the evidence. It was going to be a much higher standard. It was going to be basically in like an overwhelming degree of evidence. That was going to be a hard one to go by. Second, as you may know, Colorado, the state of Colorado, is one of the largest employers in our state, who employs me and my staff. And anytime that there is a bill introduced that could create a fiscal impact on the state itself, it has to go through a different committee and money has to be appropriated. And when the state of Colorado looked at this bill, it said, this is going to cost us a lot of money as an employer. And that money came at a time, as I said, when we were undergoing a fiscal crisis in our state. And so there were a number of factors that conspired to make it so that this bill did not pass in our state, which is interesting when you look at politically our state compared to some other states. So the question has been, will this come back? Will we see this year? Our session started and already recessed for 2021. They did, our General Assembly did 3 days of quick, necessary work, and then they closed up. And so they are going to come back and they're going to address some bills. We have not seen any bill language with regard to the presumption coming back, but it's definitely not off the table. One of the things that I've heard is that the proponents of that bill that represent injured workers, they're taking a look at what some of those estimates were for fiscal impact, those big numbers that were being put out there of how much it was going to cost to put in the presumption. And they're saying, we're not seeing that. We're not seeing payouts of this level. We're not seeing injuries from COVID being that expensive as was being estimated. So they may have a new strategy to come back and say, this was overstated and we do need to revisit this because it's too hard for workers who get sick from work to get the benefits they deserve. So keep that. I know that'll be of interest to all of you because it will have a direct impact on you. So nationally, what are some other things under consideration? Similar to the tragic events of 9/11, we're seeing that there was some talk about maybe having a national backstop of some kind for insurance companies that have to absorb COVID claims if they were to go that way, if we were to have more presumptions and things of that nature. That's kind of dropped off. It doesn't look like we're going to see something of that nature. One of the common concerns that we have from folks is, hey, if I do have COVID claims, is that going to affect me as an employer for my experience rating? Is that going to hit my premiums that I pay my commercial insurance company? And the answer for right now is no. There are rules that have been put out by the governing bodies that oversee the development of premiums, and they're saying right now that that's not going to happen. But as you know, nothing is free. If it's being paid somewhere, it's going to be socialized across the entire system. Maybe not you individually. If you have a business that has a lot of COVID claims that are being admitted and paid out, you won't see a direct spike to what your experience is creating, but it will be, as I said, spread across the entire market, one way or another. There's no free lunch in this world, as you know. So I want to switch over now about your responsibilities and how we can maybe bring that up, bring you up to speed on these things. And first and foremost, it's critical that we all, as a society, employers and as individuals, that we follow public health orders for our area. They do differ. And I understand it can be confusing at times. We haven't had a lot of practice in the last 100 years with handling pandemics. So It does take a degree of patience. It takes a degree of personal responsibility to understand what the obligations are at any given time for your area, your line of work, and where you are. The most important thing, you heard me say this, I'm an employer myself. I have over 100 employees. No, I don't own the company. I'm not personally financially liable for my organization, but I do have employees. It's critical that we make a commitment to maintain a safe workplace for our employees and our customers. And as the experts have said, when you're running a business, you have to make it safe for your customers, and you have to make your customers feel safe. It's not enough to just check the boxes and do what you're doing. You have to convince your customers and your employees that you are doing what you need to do. Otherwise, there's going to be a problem. There's going to be a problem. And then we want to make sure that you report suspected claims to your insurance carrier. Your insurance company is your best resource when it comes to making your workplace safe for most of you. Now, for some of you in very high risk occupations, you are an expert in your field and you know how to do that. But for virtually everybody else, one of your best resources is going to be your insurance company. And a lot of folks don't know this, and I hate to ever quote regulations, but our Department of Regulatory Agencies Division of Insurance has a regulation 5-3-1. And I bring it up because it has language that says, you need to understand this, that all workers' compensation insurers, and that includes Pinnacle, are required to provide free risk management. When I put in the word free because this isn't in addition to your premiums that you're already paying. So to provide risk management services, which include identifying exposures, determining varying degrees of hazards, and assisting business entities in selecting techniques to handle those exposures. So when you pay for your workers' comp premiums to cover losses and paying people when they're hurt on the job, you're also paying for risk management services. Now, this isn't, I don't want this to come across as a plug for Pinnacle, but they have an extensive and very knowledgeable group of safety and loss control representatives, and they are out in the field and they're visiting your company. And if you want them to visit you, you can request them to do that. Other companies, they may not have people in Colorado, but they will contract with people that are local to provide you those services. So take advantage of that because, you know, we know that you are good at running your business, but we don't expect you to be experts at risk management and safety and loss control. We would like you to become more knowledgeable about it, but first and foremost, check with your insurance company. So on that, let's go to some tips, though, for keeping a safe workplace. We'll go to the actual tips. Thank you, Evan. Of course, you've heard these 100 times, but you know, for some folks, you do need to hear it multiple times. You know, and I do too. I sometimes, in my desire to get things back to normal, want to slip on some of these things, but we need to keep focus on allowing employees to work from home when possible. So that's a huge culture shift for so many of us. And for me and my staff, it's probably going to be permanent and in a lot of ways. So we're going to be, we've seen how successful we can be at this, how much money we can save, and it only makes good sense to do this, as well as further ensuring the health and safety of our staff and our customers. Social distancing when you do have to be together. Again, we joke about that term social distancing. It's not really social distancing, it's physical distancing. We don't want people to feel like you're socially apart. We know that we can have a society and we can have interactions while being physically distant. So maintaining that is huge. Washing hands regularly. especially for those of you that are not in food services and other places that are not used to this as a regular requirement. And then, I won't go through every one of these, but I'll say, please keep them in mind. Remind yourself of this, remind your staff. You, as an employer, saying these words in front of your staff has an impact more than we often give credit. By being the example and telling folks that we mean it, they will follow us. So I'm going to keep that out there for just a second. But next, we're going to open it up a little bit here to some of the questions you have. You've had some great questions already that you put up, and I'm going to go through some of the questions that we've already got preliminarily, and then I'm going to switch over to some of the questions we've gotten recently here. So as I switch here, one of the first questions we've had, I think we've already addressed, how's COVID impacted the workers' compensation system? You've heard the number of claims that we've had, the questions about compensability, there's still open questions there. Until we get some of these claims pushed through the legal system, we're going to not have that full clarity. And when I say legal system, I don't mean just the first round of hearings. That doesn't mean it goes to a merit hearing at the Office of Administrative Courts and a judge rules. It's going to be yes or no. It's not done. For those of you that have been in this system for a while, you know that then it can be appealed. It can be appealed by you if you don't like it. It then goes to an industrial appeals panel that will make a ruling based upon the facts in the case. Still not done. From there, it leaves the administrative realm and it goes into the judicial realm. It goes to the Colorado Court of Appeals, and they're going to take a fresh look at the facts in the case and how it was determined. They don't retry the case. They look at whether it was handled appropriately. If there are any constitutional issues, they will look at those brand new, though. But if in some rare cases, it may even go up beyond there to the Colorado Supreme Court. But generally speaking, once it gets to the Colorado Court of Appeals, we have law. We have case law, and we can learn from there. We talked a little bit about premium rates. That was another question we had numerous inquiries about, and I hope I answered that. That it won't affect you specifically for each individual claim you have, but it will impact our state overall. It will have some kind of an impact because these costs have to be paid somewhere. We had a question with regard to employer work share programs, and I take this to mean those situations where somebody is learning a job or they're working for one place and then an employer is allowing somebody to work in their workplace. Whoever is carrying the workers' compensation liability, whoever's insuring for that, is going to bear that loss just as they would any other loss. I hope I answered that. Another question with regard to public health orders. And they have different requirements for different industries and sizes of businesses. And does that translate into workers' compensation with different requirements? No. Workers' compensation applies to any business, regardless of whether you have 5,000 workers or one part-time worker. We do not have delineations as such. What would affect you is what I talked about before, is the circumstances of your work and the ability to tie back the illness to your type of work. If you have somebody working alone at home and they contract COVID, of course, you're going to have a very good defense to say, well, that's not our fault. We didn't put you in an environment that exposed you to COVID. But then if you have somebody that's, again, working in an assisted living center and every person living there gets sick and all the staff gets sick, there's probably going to be a greater amount of evidence that you can say that this is work-related. So, and I think that answers another question with regard to compensability in healthcare. I think I just answered that. So then we have some new questions that have just come in that I want to address. So if you're an employer and you have no COVID worker comp claims, again, I think I did address this. So you're going to see an increase. Again, I couldn't tell you how much, but it would have a bearing if we are paying out for claims and they're not being tied back to the individual employers. Let me put a caveat on that, though. If we have other things happening in our system that are driving down costs overall, it could negate that impact of socializing COVID costs on our system. So it's not guaranteed how much it will be, but it is a factor. Here's a good question. On our data, what are we considering to be a COVID claim? Yeah, that's great. Because as you know, if you're filing a claim, we don't have a field on the form that says, is this COVID? So yeah, we had to develop some queries on our to run against our databases. So essentially what we did is there has to be some indication of what the nature of the injury is. And we're running a scan over those words to look for a whole slew of keywords: coronavirus, COVID, you name it, SARS, all of the keywords that we can, and we've pulled them out, and that's how we're tracing these. And we've done some testing on those, and it does bear out that that query is rather helpful. Let's see, going down through here. Yeah. So vaccines, lots of questions about vaccines. Let me just touch on that real quick. A lot of folks are wondering, can we require folks to be vaccinated? Yeah, technically, yes. That's one of the things that we've explored and learned, that an employer can do that. Do we recommend that? No, we're not recommending that at this time. Our medical director, Dr. Ethan Moses, medical director for our division, we've had a talk about this, and he said that because of the way the vaccine was authorized under the FDA, and as you know, this is the fastest we've ever seen a vaccine in modern times, pushed from research to actually going into people's arms. It was done under an emergency condition, and so it was not done under the full vetting. So it is not considered to be ethical to require people to have a vaccine under those conditions. Is it safe? Every indication that the vaccine is safe. We do not have any substantial evidence to the otherwise, and highly encourage anyone who can get vaccinated to get vaccinated. I'm seeing, interestingly, some employers getting very innovative, and they're providing incentives to their workers to, like, they're paying them to get vaccinated. Totally good idea if that can help get people to where they need to be. If your employees choose not to receive a vaccine, what kind of liability does that create for you? Well, I think what you're asking is, if that person is in the workplace and they create that much greater of a risk to coworkers and the public, does that fall back on you? Well, again, just right now where we are, if someone else gets sick from COVID and they can show that it's work related, that's not going to create an extra liability for you beyond what we've already talked about. With regard to the public, I know that there's a lot of concern about employers and businesses' liability to the public with regard to COVID. And there was discussion at the national level to try to provide some kind of immunity for employers. That's come up and been shot down numerous times. So it's not out there yet. In terms of actual, what does that business liability, what's that turning out to be since COVID started? My research has shown there's only been about 50 cases of that nationwide. So statistically speaking, that is not something that is bearing out to be a legitimate concern, liability from the public or liability of businesses to the public for COVID. So what happened to employees that could not file timely claims? Were they able to receive retroactively? So nobody is out of time yet to file a claim. If somebody got sick and they didn't file a claim, and then right now they realized, oh, I could have filed a claim for that, and I do believe it was work related, they're within their time frame to file that. But their penalty for being late in filing would be that they would lose temporary disability payments for every day that they were late. So they wouldn't get lost time payments back if they're back to work, for instance, but they would pick up from where they filed. So I hope that makes sense. But there is an ultimate deadline on this that you do have to file. So from the date that you knew or should have known, and it's different depending on the circumstances. So there's a question about benefits. What do they get if they can prove that they got it at work? Lost wages, medical visits? Yeah, both. If you can show you got sick at work, you're entitled to all of the benefits under the Workers' Comp Act that are related to that illness. So that includes medical costs and lost wage benefits pursuant to the Workers' Comp Act. Okay, here's an awesome question. It's a tough one. So when somebody gets COVID, am I saying that you have to file a claim on them even though you're paying their wages through some other program? So you have to file a claim on them. Yeah, if they say that they feel like they got it at work, you do need to file a claim. But what gets really interesting is if you're paying them full wages, they are not experiencing wage loss. And so likely they will not be entitled to any of those lost wage benefits. But you still have an obligation under your contract with your insurance company to report it. We have requirements that have been reported to us under certain circumstances. So that's different than the employee being eligible for wage loss benefits. So that gets very, very tricky. And we're watching that very closely because not only do you have these programs from the federal government like wage continuation and PPP, but we now have, as of January 1st, we have paid sick leave requirements. Okay, and going through these. Before I forget, and as we're winding through with time here, I'm going to continue to go through some of these questions. I want to let folks know that we hear you, and we know that you have a lot of questions beyond workers' comp. And I am not under the illusion that 500 employers got on this call today to hear just about workers' comp. I know that you're here because you have other questions too about unemployment insurance, labor laws, paid sick leave that I just mentioned. So I want you to know that there are resources available for you out there. Specifically, tomorrow morning, for instance, there's going to be at 10 a.m. a town hall for unemployment insurance. And I urge you to go to the unemployment insurance homepage on our website to find out details about how you can get into that town hall to learn more information. One of the key things that I know that is of concern to employers is fraud. And you're probably seeing a wave of many of you of fraudulent claims being filed on behalf of some of your workers who are still working for you. So there's going to be information about that and how to handle that in that town hall tomorrow at 10. So I wanted to keep that available to you. And also, likewise, on our website, we have great information with regard to labor standards and concerns of that nature. And with regard to paid sick leave and things like that. So bear with me, I'm scrolling through this. Question about daily health checks of your workers, keeping your workplace safe. By that, what we mean by that is making sure that people, when they come in, that they are asserting that they don't have the common symptoms. They're not experiencing any of those common symptoms. And I would encourage people to actually have their employees assert that their temperature is appropriate, that it's not high. Can an employer use a temperature scanner and scan employees in the office at any time? Under these circumstances, the pandemic and the public health emergency, yes, you can do that. That's not something we're used to in our world, as you know. Okay. So there is one here that I think I'm going to call a friend on, because I do think that this is a common theme one. If you have employees that gets and they got sick on a job site and they required the whole job site to be shut down for 2 weeks, I'm going to ask Eric. Eric on my team, if you can be promoted to perhaps address this question as to who pays when a job site gets shut down. Eric, are we there? Not getting Eric on here. Evan, can you hear me? Oh, there's Eric. Oh, can't hear you, Eric. Oh, hello. Can't hear you. All right. I was hoping Eric, we'll make sure to get this answer out to everybody if we can't get Eric on the line. Oh, you're unmuted now. No. Okay. We'll be sure to, yeah, there you go, Eric. We got you now. Oh, we had you. Okay. We're gonna, as I said, we're gonna get that back to you, everybody, one way or another. Yeah. And all right. So I think with that, we're gonna go. Let's jump down now to resources, Evan, if you don't mind. As I said, here's some links to some resources. The safety tips are there. We've got our employer guide. This is a new thing we just published, an updated guide for workers' compensation just for employers. I think you'll find some great information about how our what can be confusing system works. And as an employer, we know you have a business to run, and but we know that yeah, this is an important aspect of running your business, making sure you comply with workers' compensation. So hopefully that guide can be of help to you. The next thing I want to tell you about is our premium cost containment program. This is a voluntary program that will save an employer money if you're not already certified in it. By statute, if you get certified in this program, you are entitled to a reduction in your workers' compensation premiums. It can be anywhere from 5 to 10% in most cases, and that can be substantial. So what the program will do is it'll give you guidance on how to put into place a risk management program for your workplace. And again, your best partner in this can be your insurance company. They can help you with a program such as this. And often they have already material to help encourage you to do this. And once you've done it for 1 full year, you can come before the board in a very simple process. It's not a difficult process. And if you get certified, you can be entitled to those savings. So please keep that in mind. Going on to the next slide, I want to also include CDPHE's, the Colorado Department of Public Health and Environment's tips to keep employees and customers safe. CDPHE is the State Department, which is charged with trying to cope with this pandemic. And so they have put together some tremendous resources. Their number one weapon is knowledge. So if you can help take that knowledge and spread it and put it into place, that would be greatly appreciated, and it goes a long way to helping us all get through this. So lastly, I want to say thank you. I really appreciate your interest. I hope you stick with these webinar series programs. We want to make them of use, and please give us your feedback on how we handle these things, and let us know what you think. Thank you again. It's at the hour. We'll go ahead and wrap up. Take care. Thank you, folks.